This conference will now be recorded.
Right. So good morning, everyone. So am I audible? Jyoti Prakash, are you there? Devendra, Sahitya, Kamalika, are you audible? Am I audible to you?
Yes, sir. Yes, sir.
Yes,
Okay,
sir.
shall we start? Management methods and techniques. So we discussed already qualitative management methods. Today we will be discussing about the quantitative methods. Those are I started in the previous class, that is network analysis. It consists of two different methods, that is PERT and CPM. PERT, PERT and CPM. So PERT is nothing but program evaluation and review technique. So how you are going to evaluate a program and how you are going to review the technique, all those things are very simple. So you can every do day-to-day practice also you can follow PERT for each and everything. As example, you can see if your mother is making a meal, so she will plan how to when to start cutting the vegetables. At the same time, she will be starting the heating the water on the stove. At the same time, she will be cutting the vegetables, and then she will put the rice, like that. So every yeah, every menu will have some plan. So she will complete that both the rice and dal at what particular at what the particular time, and menu will be completed. Similarly, any program, for any program you have to plan and you have to evaluate, and then you have to review. Any problem is there, you have to review it, and then again you have to take the other decisions. So example is just starting a new medical college or hospital could be accelerated by this technique. You can see there are so many different things are there. See here we are talking about the management of a vaccination program, how it is planned. You can see decision to start measles vaccination in the society. So they have taken a decision to give measles vaccination to all the children. So number one is establishment of surveillance. So surveillance system they want to establish. And then identification of the staff. So how much staff is involved? What about the doctors, paramedical staff, nurses? Everybody you have to identify. Local epidemiological information. The main thing is before you get the information about the society, how many children are there, what are their education status, so where they are living, what about their socio-economic status, and everything. Knowledge, attitude, and practices of the society, you have to collect the data beforehand before you start your vaccination. So based on that, you have to decide and you have to give the vaccination. And then knowledge of public perception. So what the public are thinking about the measles in the society, you have to get the knowledge. You have to do the survey and get the knowledge of the people, and what is their perception towards this vaccination. You have to get the information. So based on that, you have to work out. And then availability of funds. So these are the things initially you have to keep in mind. That is availability of funds, how much funds are there, knowledge of public perception. So what is the perception of public on the on this particular program, on this particular measles vaccination? So how they are what is their perception, how what about their feeling towards this vaccination, whether they need it or they don't need it, or how the measles will be caused by, and what are the complications of measles. So whether adult or geriatric population or children are affected with measles, like that you have to prepare some knowledge based questions, and you have to take gather the information from the society. So based on that knowledge also, you have to release your pamphlets, your advisors in the form of pamphlets or signboards, or so through some other thing you have to educate the society. And local epidemiological information. So what is the agent hosted environment in that particular area, you have to study and you have to explain to the public. And identification of staff that is doctors, nurses, paramedical staff, and the fourth class employees, and the vaccine carriers, how many you are having, and what is the cold room, and everything you have to identify before starting the vaccination. Establishment of surveillance is also most important. It is the continuous scrutiny of the factors which causes the disease. So monitoring and evaluation feedback system, then trained staff, you have to train the staff, development of training material, development of health education material, and establishment of cold chain, that is availability of the vaccine, then public acceptance, then vaccination program. So these are the steps. So this is the program. This is the entire one is the vaccination program. So how we proceed with each and everything, how we are proceeding, we are representing with the help of the arrows, and finally we are developing the vaccination program. So in time it will be completed. Suppose if there is any problem in the identification of the staff, you will come to know that there is a problem in the identification of the staff. So we will take another step so that we can identify the staff very easily and we can recruit them into our program. So at any point of time, if there is any problem, we can identify very easily and you can solve the problems very easily, right? And then we can proceed with the to the next level, and finally we can complete the program within the prescribed time period. So with the help of the arrows, you will show from one level to another level how the program is going upwards, and finally how we have completed the vaccination program. So this is about the part, that is program evaluation and review technique. So at any point of time, you can evaluate the program and identify the major drawbacks in the program, and you can review it, and then you can take the decision, right? So this is the best method. Then the next method is the network. In the network analysis is the critical path method. It is a critical path method, that is the longest part of the network is called critical path method. Longest path of the network is called critical path method. Like that, suppose if you are constructing a medical college, so what you will do, you will start first year MBBS, get the permission from local university initially, from the government and from the local university initially, and then you will apply to the MCA, and MCA will come and will issue the certificate for your starting. After that, what you will do is, in case of program evaluation and review technique, you will go on for the first year MBBS, you will recruit the students, recruit the staff, then recruit the students. Students will be allotted to your college. Then all the material, clinical material, and all the investigative material, and all the infrastructure beforehand only you will develop, and then you will go for the recruitment of the students, right? So from the next year onwards, what you will do is, the constructions will go on. The constructions, as we complete the first year MBBS, before that they will complete the second MBBS, like micro, pharma, pathology, forensic, and they will recruit all the staff, infrastructure, and staff will be recruited for all the 4 departments. By the time you complete your 1 year, write your anatomy, physiology, biochemistry examination. So when you enter the second MBBS level, all the construction will be completed, infrastructure will be ready, and doctors, the professors will be recruited, all assistant, associate, and HODs will be recruited, so that by the time within 1 year, you have to complete all the 4 departments and you have to show it to the MCA. Then only you will be going to the second MBBS level. So like that you will plan, and your work will go on very smoothly up to 5 years, and after that you will get the permission. Whereas in the critical path method, what they will do is, they will plan for 5 years. So within 1 year they will complete first MBBS construction. Second year they will complete second MBBS. Third year third MBBS. After 5 years they will go to the, so after completing the entire project, 5 years project, they will go to the MCA and they will get the permission to start the medical college. It is the longest path of the network, is called critical path. It had the reduction of cost as the primary objective from the beginning. The basic process is similar to PAT, but points in the CPM represents activities. So the activities will take place very slowly. And it is the longest path. Till they complete the first one, they don't go to the second one. Whereas in case of program evaluation and review technique, so at the point of starting only, construction will go on, recruitment of professors will go on, infrastructure, they will buy they will develop all the infrastructure in the hospital only, and they will go for permissions to the MCA. Like that, all the activities will start at one point of time. But in case of critical path method, what is happening is first they will start, they will go for permission to the university. Once they get the permission, then they will start constructing the first year MBBS. After construction only they will go to the MCA and they will get the permission. Then if they get the permission, then they will start recruiting the staff. They are bringing the infrastructure. Then they will go for recruiting the first MBBS students, like that. So the thing is that it is the longest pathway. So here what is happening is activities. Here activities will happen, whereas in part 2 what is happening is at one point of time everything will be started, and they will go in one time, they will be going to start 4 or 5 activities. Whereas in case of critical path method, at one point of time one activity will be conducted. So cost as well as time are important. So in this network CPM, so cost will be more, as well as time taken will be very time will be time will be taken. It is a long time taking process. It is used in projects having prior experience. So wherever previous experience is there, in that scenario only this CPM method will be used. So critical path method is the longest path of the network. It had a reduction of cost and the price, the primary objective. From the beginning, the basic process is similar to PERT, but points in the CPM represents activities. Cost as well as the time are important. It is used in projects having clear experience. And the next method in quantitative methods is the planning, programming, and budgeting system. Planning, programming, and budgeting. Programming is nothing but bringing all the activities which are having the similar objectives under one umbrella. Like, see, we are having a vector-borne diseases control program. Before that, we had malaria program, that is totally separate program. Dengue separate program. Filariasis separate program. So there are 5 or 6 programs are there. They are individual national level programs. Individual national level programs which are going on in our country. So what they are doing is, in case of planning, programming, budgeting system, because their main objective of all these 6 programs is to control the vectors. So vector is the main cause for this diseases. So their main aim, the main aim of all these programs is to control the vector. That's why what the government of India, what they have done is they brought out a new program that is called as vector-borne disease control program. Under this program, they have included each and everything. You can take filaria is there, dengue is there, malaria is there, chikungunya is there. So many programs they brought under, so many national level individual programs they brought under one program, that is called as National Vector-Borne Program. So planning, programming, budgeting system is, it calls for grouping of activities into programs related to each objective. So what they have done is they have brought all the activities into under one program. It helps decision makers to use the allocated resources in an effective manner. So in all these programs, the main is to control the vector. So vector control measures is almost similar for all the six vectors. So it is better. So what is happening is cost reduction will come down. So we can utilize the resources appropriately. So it helps decision makers to use the allocated resources in an effective manner. And then it is zero budget approach. So for one, what they will do is they will say that is for every year. So they will give 100 crores. So in that 1 year they have to spend 100 crores. Suppose if they spend only 70 crores also, they will round off to the nearest point and they will say that all the 100% funds are utilized, and then zero budget, so that they will get the new budgets. So remaining the previous year 30 crores plus this year 100 crores they are going to spend in the next year. So zero budget approach will be there in this planning, programming, and budgeting system, so that they will get maximum amount of funds, so that they can control effectively all the vectors in the society. And our next one is the work sampling. That is judgment or observation of your work, especially for doctors, nurses, and paramedical staff who are working in institutions at the primary health center level, it may be at a community health center level, tertiary center, wherever it may be. So they are going to analyze, observe, analyze and assess the efficiency of a particular worker. It may be doctor or maybe nurse or maybe a paramedical staff. So they will analyze how they are performing their activity. For each single activity, how much time they are taking, and what are the responsibilities allotted to doctor, what are the responsibilities allotted to the paramedical staff, what are the responsibilities allotted to the nurse. So in that particular 8 hours time, how much time they are doing for they are spending for each and every activity, that will be observed, analyzed and assessed the efficiency of that particular worker, and then they will come to a decision whether they need they need some sort of special training, or they need separate resources, or they need any other infrastructure for their help, and how much manpower is needed, what is the strength of that hospital, how much inflow is there, that means how much OP is there and how much IP is there, how much manpower is needed, how much infrastructure is needed, and how much material is needed. Everything you can calculate if you do the work sampling, definitely. So how much is the OP input, how much is the OP and IP patients are there, how much is the staff in that particular hospital, what is the infrastructure in that particular hospital, and how they are spending time. If you assess it thoroughly, then you will come to know where the lacuna lies, and for that you can give training, you can give skilled training to paramedical staff or to the nurses or to the doctors, or you can increase the infrastructure, or you can increase the manpower. If you think the manpower is very less, you can increase the manpower. So work sampling studies are very important for the growth of any organization. So it provides quantitative measurement of various activities. So whatever the activities are going on in the hospital, maybe nurses what they are doing, doctors what they are doing, or lab technicians what they are doing. So all the activities which are going that are going to be measured. The parameters analyzed are the type activities performed and the time needed to do specified jobs. So what are the jobs? Suppose if you are measuring blood pressure, so how much time you are taking to measure a blood pressure? So how much time it is taking, and what is the infrastructure needed for that? So like that, for everything, it helps in standardizing the methods of performing jobs and determining the manpower needs in any organization. So work sampling method, it is definitely good. It will it will give inputs. So about the lacunae in the organization. So how much manpower is there, infrastructure is there, and what is needed by the organization. So you will come to know. It helps in standardizing the methods of performing jobs. So if you go to Central University, so for each and everything, they will have standard operating protocols. Suppose if you want to give an injection to a patient, so the patient must be asked to sit and then they will clean it with the swab, right, from periphery to center, and then they will give the injection. For this, everything in a hygienic manner. So within 10 minutes or 5 to 7 minutes, they have to complete the task. So like that, they will train their students also. So like that, in AIMS, if a person is giving injection, it is universal from MBBS students to head of the institution, or you can say director or dean of that institution. Institute must follow the same procedure. So for every procedure, they are having standard operating protocols for everything, for writing the drugs, or for giving injections, or for doing operations, for each and every operation, everything, whatever activities you do in Central University, they are having standard operating protocols. So whenever you join any Central University, they will they will have a training sessions will be there for 1 or 2 months, maximum 6 months training will be there. So they will so that you will get acclimatized to that environment, you will get acclimatized to that protocols, and when you start your job, you have to do whatever the protocols they are following. You cannot do by your own. You cannot bring new protocols, right? So standardizing the methods of performing jobs and determining the manpower needs in any organization. So what is the manpower needed? What is the input and output of that organization? How much manpower is there? Whether it is sufficient to perform all the activities or not, we will assess. And if at all, if any necessary manpower is needed, then definitely we will go for recruitment. Then next method is the decision making, like the differential diagnosis in medical practice, decisions to be made for development of resources and strategies for providing healthcare. So decision making is very important in any healthcare organization. So with incomplete data, you should not take any decisions. Suppose if you are having insufficient data or incomplete data is there with you, based on that insufficient data, if you take decisions, it will cause adverse effects to the society. So that's why what you have to do, always try to collect as much data as possible, come to study the data properly, analyze it properly, and then come to the conclusions, and then take the decision on it. So incomplete information or incomplete data, insufficient data will not give good decisions. So decisions are very important in the healthcare industry. Decisions are very important in the healthcare industry. Whenever you are taking decisions, you have to take on the based on the thorough information which you are having, a thorough analysis you have to do, and you have to discuss with your seniors, seniors or experienced people. It is not that seniors only has to take the decisions. Even juniors can take the decision, can give the inputs to the directors about their opinions regarding the decisions. Then they have to summarize it. They have to take the information from all the departments, and then finally they have to come out with the decision. So decision making is very important in any organization. If you take the good decision, it will have fruitful results in the society. If you take a bad decision, it will have negative impact on health of the society. So that's why decision making is very important. Decisions making is very important. Decisions may be in terms of resources. Decisions may be in terms of strategies what to be implemented to reduce the COVID in the society. Strategies for providing healthcare services, or strategies for reducing the obesity in the society. Maybe whatever it may be. So you have to take the opinions from the different specialized specialists, and you have to summarize them, and finally you have to take the decision. So that is decision making is also important. That is also quantitative method. So if you look at the quantitative method, that is decision making is very important. Then work sampling, they all may get, you may get them as a short notes. Planning, programming and budgeting. Network analysis. So network analysis consists of PERT and CPM. PERT means PERT, that is program evaluation and review technique, and CPM is the critical path method. So this all this will come under the quantitative methods, which are very important. You may get in the examination about the quantitative methods or the single method. They may ask you for the short notes. Next, we will go to the health planning in India. So health planning in India, the guidelines for national health planning. So the guidelines for national health planning were provided by a number of committees. So before that, we don't have any health plan in India. So government of India officially given they have given permission to the committees to study and work out what is the health scenario of India, to study them and give their decisions or recommendations how to improve the health of the nation. So they have given different committees to review the existing health situation and recommend measures for further action. So they have appointed the different committees at different levels, so that the committee can go into the society to they travel throughout the nation and see what is the health situation in India at that point of time, and what are the necessary steps the Indian government has to take up, so that they can come out of that health scenario. So they have appointed committees. So what are those committees and what are their recommendations? We will see one by one. So if you look at the Board committee was appointed at 1946, right? So it is the Health Survey and Development Committee. The name of that committee is Health Survey and Development Committee. So what is the health situation at that point of time? That is in 1946. 1946. So they have to travel entire nation and see how the health scenario is there in the entire nation. What the people need, what are the people needs, basic needs, health needs. They have to identify and they have to come out with the recommendations. So that committee name is called as Board Committee, and the committee's objective is to do the health survey and development and how to develop it. So to survey the health conditions and health organization in the country and to make recommendations for further development. So what is the prevailing health scenario at that point of time and what are the necessary recommendations the government has to do. So this committee has to study and they have to give recommendations to the government so that the government can implement the recommendations properly. So what are the recommendations of Board committee? We will see one by one. Integration of preventive and curative services at all administrative levels. So we are having different branches, that is director of health is different, director of medical education is different, and the director of Vijay Kumar commissioner is different. So we are having different levels at different administrative levels, like director of health is there. So they are mainly concerned with the preventive aspect of the society, like you can see nutrition, safe water drinking, safe water drinking, maternal and child health. So they are not they are mainly concerned with the preventive and promotive aspects and a little bit curative aspects. They are much the doctors are not much trained in terms of curative aspects. So they will be having only preventive, like program implementation, then program implementation, maternal and child health, nutrition, safe drinking water. So those are the primary areas where this director of health will be working, right? And if you look at the curative services, so what is happening is we are having Vaidya Vidyan Parishad. So this community health centers, area hospitals and district hospitals will come under this curative services. They are mainly concerned with the treatment of the patients. They are mainly concerned. If you look at the district hospital, if you look at the community health center, if you look at the area hospitals, they are mainly concerned. They are not concerned with the preventive aspect. They are mainly concerned with the curative aspects. So only treatment, only treatment. And if you look at the tertiary hospitals, like teaching hospitals, you take any medical college, any medical college. So their first objective is research. Second objective is they are training, teaching and training the UG, PG and super specialty courses. Third one is the patient care. Third objective is the patient care. So like that at all levels, at all administrative levels. So there are different branches are there, like director of health. They are mainly concerned with the preventive and promotive aspect, whereas Vaidya Vidyan Parishad, they are mainly concerned, like district hospital, community health centers, they are mainly concerned with the treatment aspect, whereas tertiary care centers, their main motto is number one is teaching and training, second one is research, third one is patient care. So their objective is totally different. So this Board committee, what it said is there must be integration among all these three: preventive, promotive and curative services must be integrated, so that the people will get all the three at one place. All the three, like preventive, promotive and curative services and curative and rehabilitative services at one place, at one administrative levels, then it will be better. Then it will be better. People will get maximum benefit out of it. So that's why what they recommended is it should be integration of preventive and curative services they have to do, and development of primary health center in 2 stages. So at that point of time, we don't have any primary health centers and we have to start. So basic level at that point of time, the most dangerous diseases were communicable diseases. Communicable diseases, lack of sanitation, safe drinking water, safe drinking water. So these are the basic needs which the people need, at that point of time. That is in 1946. So that's why what they have done is preventive services must be established in each and every area, so that the people will get the basic preventive services very easily. That is development of primary health centers at 2 stages. That is short term measure and then long-term measure. So short-term measure, what they have to do is they have to construct a PHC for every 40,000 population with secondary health centers to serve as a supervisory, coordinating, and referral institution. So for every 40,000 population, there must be one primary health center. For every 40,000 population, there must be one primary health center, and provided that there must be secondary health center, that is community health centers must be there for 1.5 lakh to 2 lakh population, for 1.5 lakh to 2 lakh population, so that all the specialty services must be available. Suppose if any case is there in the primary health center, if it is not possible to treat at the primary health level, then it can be referred to the community health center. So community health center to serve as a supervisory, coordinating, and referral institution. So what they recommended is that as a short-term goal, for every 40,000 population, there must be one primary health center surrounded by secondary health center, which can take care of the complicated or serious cases, and it must be a referral institution to all these primary health centers. So nice, it's a short-term measure. It's a good decision which they have taken up. And then coming back to long-term measure, that is it is also called as 3 million plan. So long-term measure, it is also called as 3 million plan. That is primary health center with 75 bedded for 10 to 20,000 population. So their long-term measure is every primary health center must be converted into almost like a community health center with 75 bedded for 10 to 20,000 population. So for even 10 to 20,000 population, they want to establish a primary health center which consists of 75 beds. And then secondary units, that is 650 bedded, and district hospital with 2,500 bedded. Till now, we are not able to reach that. If you look at the Eluru district hospital, we are having only 250 beds. And in 1946, the board committee told that the district hospital must consist of 2,500 bedded. District hospital must consist of 2,500 bedded. Secondary units with 650 bedded. It is not possible till now. So the government has not taken any. Government has not shown any interest on this. They have established a primary health center for every 40,000 population. That short-term measure is achieved because at that point of time it is very needed for that population. That's why our PHCs are there for 40,000 population. After that, that PHC was not converted into 75 bedded. After that, the district hospitals are not converted into 2,500 bedded hospitals. Some are there. And the main recommendation what they have done is 3 months training in SPM to prepare social physicians. So this is the committee which has recommended that all the doctors who are working in the medical colleges, they must be during their internship. During internship, they have to work in the community medicine department for 3 months, so that they will get acquaintance, or they will get they will be associated with the rural people and the urban people, and they will come to know what are the most common diseases among the rural and urban people, and their lifestyles, their socio-economic status, how they behave, and how you have to treat them, how to behave with them. All those things you will be learning in the community medicine department. So that's why you will be trained for 3 months in the SPM to prepare to make you as a social physician, so that you will get acclimatized with the social environment where you are living, right? So the main objectives, the main recommendations of board committee in 1946 was they want to integration of preventive and curative services at all the administrative levels, development of primary health center in 2 stages. That is in the first stage. In the first stage, what they want to do is a short-term measure, that is they want to construct a primary health center for every 40,000 population, with secondary health center to cater as a supervisory, coordinating, and referral institutions. And the long-term plan, that is also called as 3 million plan, PHC for every 75 bedded hospital, 75 bedded for 10 to 20,000 population, and they have to establish the secondary units with 50 bedded and district hospital with 2,500 bedded. So 3 months training in social and preventive medicine to prepare social physician. These are the recommendations given by the Boer committee in 1946. And then we will go to the Mudaliar committee, that is in 1962. So almost you can see 1946, and the next committee came into existence in 1962. It is also health survey and planning committee to survey the progress made in health field and to make recommendations for future development and expansion of health services. So the government of India in 1962 also appointed a committee that almost after 1946. So this is the next committee in 1962. So a lot of time has happened. So how now what is happening at the grassroots level? We want to know what is the health scenario of the population. We want to know. So that's why what they have done is they have appointed a committee, that is Mudaliar committee in 1962. So what they found out and what are the recommendations of this committee, we will see. It found the quality of services at PSC inadequate and advised strengthening of PSC, sub-divisional and district hospitals. So when they went there and they did the survey at the primary health centers, so they came to know that the services provided at the primary health centers are inadequate, because what they said is the one primary health center for every 40,000 population. What should be the staff recruitment? What about the doctors? What about the nurses, paramedical staff, and programs? How to handle them? There are a lot of things are there in primary health center. It is not easy to work. There are a lot of things are there to do at the primary health center, because prevention is very difficult. Prevention is very difficult. So it found the quality of services at primary health center is inadequate, definitely, because they have constructed and they have not recruited the doctors. At some places they have not recruited the paramedical staff. At some places they have not given the drugs properly. A lot of things are there. A lot of issues are there. That's why the primary health centers are not functioning properly. And advised strengthening of PSC, sub-divisional and district hospitals. So what they have done is it is better to start the district hospitals as well as sub-divisional hospitals, so that these primary health centers, though they are working, they are inadequate. They must be strengthened in all the aspects. In all the aspects means in terms of manpower, material, and the resources. And the resources must be adequate in the primary health center, so that it can work effectively in the society. So what are the recommendations given by this Mudaliar committee? We'll say consolidation of advances made, strengthening of district hospital with specialty services. Though at the primary health center, doctors are working, they are mainly focusing on the preventive aspects. For anything, they are sending them to the secondary level, that is to the community health centers or area hospitals or district hospitals. But the specialty services are lacking there. So what the government has to do is they have to recruit the specialty services at the community health center level or at the district hospitals. So specialty services must be provided, and then regional organizations in each states between the headquarters organization and the district. So you see, for what they have done is in those areas for entire Telangana, they have taken Usmania as the standard regional hospital. You can see for Vizag also, for that Vijayanagaram, Srikakulam and Vizag. So they have constructed Visakhapatnam. For east and west also, for east, west and Vijayawada, they have constructed this Guntur Medical College. For Rayalaseema, Kurnool Medical College, they have made. They are called as a regional organizations, or you can say regional hospitals at that point of time. So regional organizations in each states between the headquarters organization and the district. So they have made it like that. Each primary health center not to serve more than 40,000 population. So if they are having till now also we are having primary health centers with more than this 40,000 population. More than this 40,000 population, till we are having so many primary health centers. So improve the quality of services provided by the primary health center. So whatever the services we are providing at the primary health center, it has to be improved, because at that point of time we don't have the drugs. We are not manpower is insufficient, and for everything we are referring them to the higher centers. So if you improve that, if you improve the quality of services, definitely people will come forward and utilize the services of the primary health centers. Integration of medical and health services. So medical is totally preventive, medical and health services. So preventive and curative services must be integrated. That scenario, it has to be completed as early as possible. And creation of all Indian health services on the pattern of IAS. So in 1962 only, so Mudaliar committee has already recommended that. So we must have an all Indian health services on the pattern of IAS. So for doctors has to become the IAS officers for health system, especially for health system. So doctors must become the IAS officers in that scenario, so that if they have the knowledge of health system, they can perform, they can improve the performance of the health services. Till now, the government has not taken any steps. Right now, they are fighting with the central government to create the IAS the IAS post for the doctors in the all India health services. We don't know, maybe next year it may come. So all of you can prepare for this. Be ready. By the time you complete your MBBS, so all Indian health services will be in force, and you can become the IAS officer. You can become the IAS officer for that. So be prepared for this. It is there with the central government. I don't know when they will take the decision, and the doctors are fighting for it. And the doctors are fighting for it. Definitely it may come, maybe next year, or maybe after that, maybe it may take 1 or 2 years. It may take 1 or 2 years, or just before the election they may sanction. I don't know, but still, but definitely it is going to come. It may take 3 years or 5 years, but definitely it will come. So already doctors are fighting for this. So anybody interested, right now you start reading. So definitely will become an IAS officer, and you can control you can improve. Instead of controlling, you can say you can improve the health services in the entire India. So then coming to the Chedda committee. So once again, we will go through the Mudaliar recommendations. You can see consolidation of advances made. So what are the advances made by the Board committee? They have made it in a consolidated statement. A strengthening of district hospital specialty services. So at that point of time, they have constructed a sort of district hospitals, but specialties were not recruited in that. Maybe because of lack of specialty services, or specialty people are not available. Till now, majority of the hospitals, they don't have the specialty services. So so at that point in 1962, I don't think that they are having sufficient specialties available with the government, so that they can recruit them in the district hospital. So what they said is they need specialty services at the district hospital. And then regional organizations in each states. So they want regional organizations in each states between the headquarters organization and the district. So regional hospitals they have established, like I said, I told you, for the entire Rayalaseema, Kurnool was the Kurnool Medical College was the hospital. This is a regional hospital in that area. So yeah, all the cases will come to all the complicated cases will come to the Kurnool, whereas the Vizag, the similar way, and then Guntur, similar way. So for the entire regions, district headquarters, they made it the regional organization, so that they can cater to a huge population. Each primary health center not to serve more than 40,000 population. So they want to strictly bind to the principle that every primary health center must be catering to the population of 40,000. Improve the quality of services provided by PSCs. So definitely they want to improve the quality of services at the primary health center. Integration of medical and health services. Creation of all Indian health services on the pattern. And then Chedda committee in So Chedda committee came in 1963. So after Mudaliar, again in 1963, there was a Chedda committee. So what they have done is, the vigilance operations in respect of National Malaria Eradication Program should be the responsibility of General Health Services. So whatever at that point of time, malaria was highly fatal, highly prevalent, and it is the most dangerous disease at that point of time. So the vigilance operations are going on in respect of National Malaria Eradication Program should be the responsibility of General Health Services. So whatever the under the National Malaria Eradication Program, whatever the staff is recruited, and they are doing the general health services also. So they have to give vaccination, they have to give, they have to follow the maternal and child health, they have to go for they have to maintain the sanitation, maintain the registers, and then they have to see the malarial operations also. So basic health workers per 10,000 population, they are known as multi-purpose workers. So all the works they have to carry out. The family planning health assistants were to supervise 3 to 4 basic health workers. So at that point of time, family planning, family welfare program was there, 1954-51. 1954 National Family Welfare Program was started. So at that, the family planning health assistants were there to supervise 3 to 4 basic health workers. So Chetta Committee, 1963, malaria eradication program. So those people have to take the responsibility, and they are called as multi-purpose health workers. The family planning health assistants were to supervise 3 to 4 basic health workers. And then started the Mukherjee Committee in 1965 to review the strategy for family planning program. So the recommendations given by the Mukherjee Committee are separate staff for family planning program, because this family planning program people, they are taking care of all the other programs. As a result of that, they are not performing in that specific national family welfare program. So that's why what they have done in Mukherjee Committee, what they want, they are given the recommendation is that there must be separate staff for family planning program, so that they will work only on the family welfare program only. They are not concerned with other programs. They are not concerned with the other programs. So the family planning assistants were to undertake family planning duties only. That is the main reason. Mukherjee Committee, what it advised is the family planning assistants who are working, who are undertaken under this National Family Welfare Program, they have to work only for the family planning duties, and rest of the programs they are not concerned. They are not concerned with the rest of the programs. So basic health workers were to be utilized for purpose other than family planning. So basic health workers who are working at that point of time, they must be utilized, their services must be utilized for the other services. And these family planning assistants must work for the family planning program only. They are not concerned with other programs. So basic health workers who are present at that point of time, they must be utilized, their services must be utilized for all the programs except family planning. Dealing the malaria activities from family planning program. So what they have done is they made it malaria program separate and family welfare program separate, because this family planning assistants are working for all the programs, especially at that point of time malaria is very severe. So majority of the family planning assistants were working for the malaria program. So they are doing all the activities in the malaria program, and they are not giving much importance to the family planning, family welfare program. So that's why the program has suffered a lot. So that's why the program has suffered a lot. So the Mukherjee Committee has identified the lacunae, and they are given the recommendation that they must be delinked up. There must be linked up. Malaria program people, they are going to work for the malaria, and family planning people, they are going to work for the National Family Welfare Program. So that they made it very clear. So the committee worked out the details of the basic health services provided at the block level. So at the block level, what are the services they are to provide? So the committee has worked out, and they came out with the solutions. So it has worked out properly for the government. Then Jangalwala Committee, that is in 1967. So I think it is 11:30. So I will stop. I think you are having next class at 11:30. So I think I am thinking that all are present. We'll go through that. 126 is it is showing here. Okay, I am considering all as present. Thank you. We will meet you again in the next class.